Kate.
Hi.
How are you?
I'm doing okay. How are you doing?
I'm good. Thanks for asking. My name is Dr. Matt. I'm going to do your exam today. Let's go ahead and verify your first and last name and your date of birth.
Great. It's Kate C. ASMR, March 10th, 1997.
Okay, perfect. When was your last physical?
Around a year ago.
Okay, I'm going to ask you some questions to make sure that I have your medical records in order. Do you have any allergies?
I don't.
Okay. Okay, any medications that you're taking on a daily basis?
Just my birth control.
For how long have you been that?
Around like 15 years.
Okay. And when was your last gynae exam?
Like 6 months ago.
Okay. Any surgeries?
No.
Any injuries? Any broken bones?
No.
Are you experiencing any pain right now?
No.
Okay. Do you wear contacts?
No.
Okay. When was your last vision check?
Around 6 months ago.
Okay. Any family history of heart disease?
No.
Okay. What we're going to do today, I'll take your vital signs and then I'll do a full body exam to make sure that everything looks good. This is what we have to do annually.
Okay.
And I'll have you change an account so that we can start taking your vitals.
Okay.
All right, I'll step outside. I'm going to go ahead and put gloves on. We'll take your vital signs. Have you noticed any fever or like symptoms?
No.
Okay, I'll take your blood pressure first. This will go on the upper side of your right arm. Go ahead and uncross your legs for me, please. Blood pressure is within normal limits. This will go on your index finger. Did you have anything to drink, hot or cold, before coming in?
I had some cold water.
Okay, we'll put this under your tongue. Go ahead and hold it with your right hand. Perfect. My pressure was 120/70. Heart rate is 82 resting, and oxygenation is 98% on room air. Let's go ahead and check that. Oops, sorry. 96.2 Fahrenheit. Okay. We have all the vital signs. I'm gonna ask you to lay down and we'll start by examining your head and your face.
Sounds good.
Okay, Kate. I'm just going to start by palpating your submental lymph nodes using a circular motion to determine if there's any inflammation. Moving back to the postauricular lymph nodes. And preauricular lymph nodes. Palpating sinuses right under your eyes, lateral to the nose of the bridge. And above the eyebrows. Okay. Can you please tell me if you feel this equally on both sides?
Yes. Yes. Yes.
Okay. Go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right. Right. Left. Left. Left.
Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Cold. Warm.
Just doing some measurements that we have to make sure we have in your file. One of them being head circumference. So go ahead and lift your head up when you're ready. Place it back down. Good. Lift it back up. Thank you. Okay, can you go ahead and open your eyes? Very good. Now, can you cover your right eye for me? Okay, so I have here some cards. Are you able to see them?
Yeah.
Alright, can you please identify what you see in the card?
An eye.
And what color is this?
Pink.
Okay. What about this? What is it?
A leaf.
And what color is the card?
Purple.
Okay. What about this? What is it?
A caterpillar.
And what color is the card?
Orange.
Very good. Go ahead and switch eyes. Can you identify this object?
A shrimp.
And what color is the card?
Yellow.
Okay. What color is the card?
Blue.
And what do you see here?
An octopus.
Very good. One last one. What color is this?
Purple.
And what do you see here?
A giraffe.
Very good. And that looks normal. You can go ahead and relax your eyes. Do you feel the vibration?
Yes.
Tell me when it stops.
No.
Do you feel this?
Yes.
Tell me when it stops.
No.
Okay. Checking your hearing one more time. Go ahead and tell me which position here is louder. Position number 1 or 2.
2.
Position 1 or 2.
2.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
Excellent. Okay. Now we're going to check your facial sensation for painful stimulus and dull stimulus. I'm going to touch you with a sharp object. This is what sharp is going to feel like. And then a dull, soft object. Now go ahead and tell me if you feel sharp or dull.
Okay. Sharp. Dull. Sharp. That one was hard to tell. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Okay, perfect. Now I'm going to touch you with a different surface on the face. I'm going to need you to tell me if you feel it on the left or right.
Okay. Right. Right. Left. Left. Center. Right. Left.
Okay, let's go ahead and check your scalp next. Have you noticed any type of itchiness or redness?
No.
Okay. Do need a little bit of light. We do need a little bit of light. So let's see what we have here. Not seeing any redness, which is a good sign. But I do want to make sure that there is no vitamin deficiency. Sometimes we would see it in the scalp if patients have vitamin B12 deficiency. Do you feel this cold or warm?
Warm.
And does this feel sharp or dull?
Sharp.
And does this feel sharp all the way?
Yes.
And does this feel sharp?
No.
Okay. That's good. Seeing a little bit of redness. Have you noticed some itchiness around the top of the scalp?
A tiny bit.
Just look like they're papules and they're clustered. So we're going to go ahead and take a sample. First, we're going to apply a basing serum. It helps to lower the acidity so that we can collect the sample properly. We do have to take 2 samples. Okay. Very good. Have you noticed any changes in your smell?
No.
Okay. Go ahead and try to take a deep breath in and tell me what this smells like.
Orange. Mint.
Okay, go ahead and give me a big ah. Gingiva is a little bit red. Not sure what's going on there. Maybe your body is just fighting an infection. Let's go ahead and check your ears. tympanic membrane is broke, right? A little bit of redness here too, so that could explain. Okay, very beautiful. Looks good. Alright, I'm gonna have you look up towards the ceiling for me. Try to keep your eyes open. Not seeing any redness there. Optic nerve is a little bit inflamed on the right side. Okay, let's go on and check your heart now. Is it okay if I put the stethoscope under the gown?
Yes.
Heart rhythm is normal, so normal sinus rhythm. I'm not hearing any skipped beats. Let's go ahead and check for murmurs. I can hear only S1 and S2. No S3, no S4. Can you go ahead and take a deep breath in? And exhale. And again, breathe in. And exhale. Okay, bilateral lung sounds are clear. Let's go ahead and first listen to your abdomen. It's going to feel a little bit cold. Okay. Progressing all four quadrants. And now I will do a gentle light palpation first, looking for anything swollen. Let me know if you feel any type of tenderness as I'm doing this. And now I'll do a deeper palpation as well. Okay. Let's go ahead and check your back now. So I'll have you flip on your tummy.
Okay.
Palpating spine, we're looking for signs of scoliosis. Which is a spine deformity. Sometimes it can happen because of bad posture. Centimeters. We're checking for misalignment and asymmetry. So the right side is a little bit more elevated. It's about 2 centimeters difference. Checking for any abnormal neurological responses. Looking for any pulsations around the spine. Checking for any skin lesions. Any redness, something that would indicate an inflammatory response. It's a very good sign we're not seeing any redness. A little bit of inflammation in the thoracic area. We can order some more tests. Go ahead and take a deep breath in for me. And exhale. And again, breathe in. And exhale. Now we're going to check the base of the lungs. Take a deep breath in. And breathe out. Very good. Let's do that one more time. Good. And breathe out. There were some diminished sounds on the left side, so we're going to go ahead and percuss, see if there's any fluid buildup in the alveoli. Have you noticed any kind of cough in the last 2 weeks?
No.
Go ahead and say 99.
99.
Again, 99.
99.
One more time, 99.
99.
Good. Now let's go ahead and check for any abnormal sensations. Something like a pinched nerve could definitely trigger that. Can you guys tell me if you feel this sharp or dull?
It's sharp.
What about now?
Just kidding, that one is sharp.
Okay, no problem. What about now?
Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Sharp.
Okay. Excellent. Alright, I think we're done. There are definitely some abnormal results that I'm gonna have to do a little bit more testing. So I was able to hear a murmur, which that indicates we need to get an echocardiogram.
Okay.
And depending on what results we get from there, then we're gonna have to do maybe more testing. Also on the back, let's go ahead and run a CT of the back.
Okay.
And I'm not very concerned, but I just want to cover my bases and make sure that we are ruling out anything that is more serious. And once that is ruled out, we can go ahead and start with a treatment.
I appreciate that. Thank you.
You're welcome. Do you have any questions for me?
Should I be concerned about the heart murmur?
No, no. Sometimes that can be congenital, which means that you were born with it and maybe it wasn't diagnosed. But let's make sure that the echo does look good and we'll go from there.
Okay. Thank you.
You're welcome. I'll see you back in a couple of days. All right, let me know if you have any questions in the meanwhile.
Thank you, doctor.
You're welcome. Hi, Nicole.
Hi.
My name is Dr. Mad. I'm going to do your cranial nerve exam. Go ahead and tell me your date of birth and your last name.
October 21st, 1998. My last name is Smith.
And what brings you in? Why do you want to do a cranial nerve exam?
I'm having some dizziness. I feel really loopy. And I've had like just weird sensations in my arm and my back. I'm like losing sensation of feeling in those areas, which really bothers me.
Okay. Well, you're definitely young, so that kind of problem is something that we need to take very serious and to investigate a little bit. For how long has this been going on?
About a month and a half, I would say like 6 or 7 weeks.
Have you noticed any loss of taste or smell?
No.
Are you taking any medications on a daily basis?
No.
Do you have any allergies to medications?
Penicillin.
Are you having any pain?
No pain. No.
And how would you describe the loss of feeling? Do you feel any kind of pins or needles?
Sometimes it's normally like I'll touch an area and I just won't feel it.
Okay.
So it won't register.
Numbness.
Yeah, it's a numbness sensation.
Okay. Have you noticed any blurry vision, double vision, any peripheral vision loss?
No,
Do you wear contacts?
I do.
When was your last eye checkup?
About 10 months ago.
Have you noticed any changes?
Nothing really. No.
Okay. Have you noticed any lumps or bumps anywhere on the body that I should check right away?
No.
Okay. I'm going to go ahead and put gloves on. I'm going to listen to your heart and lungs first. I can hear only S1 and S2, no S3, no S4. I'm going to listen to the bell for any murmurs. Can you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, good. Breathe in for me and strongly exhale. And again, breathe in and exhale. Okay, no crackles, no wheezing.
Okay.
I'm going to check your pulses as well. 2 plus. Synchronizing. Perfect. I'll take your blood pressure. Is this arm okay?
Mm-hmm.
I'm gonna have you uncross your legs, please. Blood pressure is a little bit elevated, 130/65. I'm going to go ahead and remove this. Let's go ahead and check your temperature. Do you feel like symptoms?
No.
So I can consider this a lot of something. Any feel like symptoms?
No.
I'm going to put this under your tongue. Go ahead and hold it for me, please. Thank you. We'll measure your oxygenation as well. This will go on your left index finger. Okay, let's go ahead and check that. Thank you.
Thanks.
97.2. That's really normal. Perfect. Alright, so let's see. I'm going to check your reflexes first. I'm going to have you relax your lower jaw. Good. Go ahead and relax your arm for me. So leave all the weight on my hand. Perfect. Good. Okay. Relax. Perfect. Okay. Relax. Okay. Relax. Good. Okay. Alright, and relax your weight. That's great. Okay. Okay, diminish reflexes on both sides. We're going to have to check your thyroid levels as well to make sure that it's not a hormonal imbalance. Okay. Alright. Let's go ahead and look inside your ears. You're just going to feel the tip of the otoscope inserting. Good. Tympanic membrane is perforated on both sides. We're going to check your optic nerve now. Perfect. So I'm going to have you look behind me straight at the wall. Try to keep your eyes open. Good. Okay. Perfect. I'm not seeing any lesions or anything like that, so that's
Okay.
very good.
Good.
I'm going to check your hearing now. Go ahead and tell me when you don't hear the sound anymore.
It's gone.
Go ahead and tell me when you don't hear it anymore.
It's gone.
Now, can you please tell me which position here is louder, position number 1 or 2?
Okay.
So this is 1. and 2.
2 is louder.
This is 1 and 2.
2 is louder.
Okay. I'm going to go behind you, and I'm going to need you to tell me when you don't feel the vibration anymore.
I don't feel it. I don't feel it.
Okay. We're going to check your taste now. So I'm going to put 1 paper on your tongue.
Okay.
Let's see. It's there. Alright, here we go. Go ahead and tell me what this tastes like.
It tastes like a piece of paper.
Okay, so like it doesn't have any taste. Is that what you're saying?
It doesn't have any taste.
Alright. What about this one?
Oh. Wow. That is like a very strong flavor.
Okay. Is it sweet, bitter, salty?
Bitter.
Bitter.
Yeah. Oh, not good.
I'm sorry.
It's okay.
Okay. What about this one? Alright, what does that taste like?
Sweet.
Sweet. Let's go ahead and try just one more. This will allow me to understand if there is any nerve damage
Okay.
on the upper spinal cord.
That is sour.
Sour.
Yeah.
Okay, so the results are normal, which is very reassuring. I'm going to go ahead and do a smell test as well. Okay, so first we're going to go ahead and check patency. I'm going to cover one nostril. Breathe in, breathe out. Alright. Breathe in, breathe out. Good. Okay, go ahead and cover one nostril for me. And I'll have you slowly breathe in and slowly breathe out. And what does that taste like for you?
Some, like a tree, like maybe evergreen tree.
Okay. Let's go ahead and switch layers now. Thank you.
That one smells like a pasta sauce.
Okay. And now you can breathe in with both layers.
With both. That one smells like a lemon zest.
Lemon zest. Okay. Everything looks very good. I have no concerns there.
Okay.
I'm going to go ahead and lay down now. I will do your upper body sensitivity. I'm going to start by palpating your preauricular lymph nodes. And now I'm palpating postauricular lymph nodes to see if there is any swelling. Submental lymph nodes are right under your chin, so we're going to go ahead and check those as well. mentioned earlier that we're going to check your thyroid gland, which is situated on the inferior side of your neck, right at the base. Usually it's non-palpable, and I should not be feeling any kind of lumps. Everything looks normal. Okay. Now I'm going to do a sensation test on the face. Can you go ahead and tell me if this feels sharp or dull?
Dull.
What about this one?
Sharp.
Okay, so we're going to continue this test. Throughout the face, I'm going to touch you with these two textures. Tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp.
Okay. Now go ahead and tell me if you feel this cold or warm.
Cold.
What about now?
Oh, that's cold. That's really cold. Warm. Cold. Warm. 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 Cold. Cold. Warm. Warm. Cold.
Okay. Can you please tell me if this changes in intensity?
It stays the same.
And now?
It's the same.
Okay. Everything looks normal here. We're going to go ahead and focus on your scalp now. Go ahead and tell me if this feels cold or warm.
Warm. Cold. 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 Cold.
Okay. And does this feel sharp or dull?
Dull. Dull. Sharp. I can't really feel that. I think it's sharp.
Okay. Does this feel sharp all the way?
I could feel most of it being sharp.
Does this feel cold or warm?
I can't tell.
Okay. Does this feel dull?
I think it's dull.
Okay. Is this sharp or dull?
Dull.
What about now? What does it feel like?
Sharp.
And is this cold or warm?
I can't tell.
What about now?
Maybe warm? Dull? Dull.
Does this feel cold?
Doesn't really feel like anything.
What about now?
It's the same.
Does this feel cold or warm?
I can't tell.
And here?
Same, I can't tell.
So there's definitely something going on in that spot. I'm just going to do a few more tests here and then we'll move on to the arms and back. Does this feel sharp or dull?
Dull. Dull. I can't tell.
What about now? Does this feel sharp?
I think that's sharp. Yeah.
Does this feel sharp all the way?
No, not all the way.
Tell me when you don't feel the vibration anymore.
I never felt it. I can't feel anything.
Okay. So we're gonna go ahead and check your arms and your back now. I just want to make sure that there is that the nerve damage is localized.
Yeah, something is definitely going on.
Okay. So first, go ahead and tell me if you feel it on the left or right.
Right. Left. 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 Could you do it again? I think that was the left.
Okay. Now go ahead and tell me if you feel this wet or dry.
Wet. 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 Dry. 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 Wet. Wet.
I'm going to go ahead and listen to your lungs from the back. Take a deep breath in for me. And exhale. And again, breathe in. And breathe out. Okay, no fluid buildup. Can you please tell me if you feel 2 pressure points or 1?
Okay. One. 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 Two. Two. One. Two. One. Two. 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 One. One.
Okay, I'm going to go ahead and palpate your spine. I'm not feeling any deviation of the normal curvatures. Go ahead and tell me if you feel this on the left or right.
Left. Left. Right. Left. 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 Right. Left. Left. Right.
Go ahead and tell me if this feels sharp or dull.
Dull. Dull. I didn't feel anything. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Dull.
Go ahead and tell me if you feel this vibration.
I feel it.
Tell me when it stops.
It stopped.
Tell me if you feel this.
Yes,
Tell me when it stops.
it stopped.
Same thing.
I feel it. It stopped.
Okay. Okay, we're going to order some more tests. I definitely want to do an MRI of the chest and the spine just to rule out anything that might be compressing the nerves.
Okay.
All right.
Hi, Katie.
Hi.
It's very nice to see you again.
Good to see you.
My name is Dr. Matt. I'm going to do your examination today. How are you feeling?
I'm good. I'm here because, like, in the past couple months, I started to feel like shaky in the hands
and legs a little bit out of nowhere.
Okay.
It's not related to like being hungry or like it's not the blood sugar drop kind of shaky. It just happens for no reason. And my face kind of gets twitchy from time to time, so I'm worried about that.
Okay. So just these two symptoms. When did they start?
Started like 3 months ago. And the twitching of the face started about a month ago.
Okay. Any new events going on in your life?
A divorce. Yeah.
Okay. That definitely can bring in a lot of stress.
Yeah.
Physically and psychologically. So
Yes.
let's see. Have you noticed any numbness or loss of sensation?
I haven't, but I get cold really easily, so I guess I get numb because of that.
Okay.
Yeah.
We would like to check your blood sugar today as well.
Okay.
Have you noticed any increased perspiration or sweating?
At night, when I wake up in the morning, sometimes I have a lot of sweat.
Okay.
In the feet especially, too.
And do you remember for how long has that been going on?
That's been going on. That's about the same time that the shakiness did.
Okay.
Yeah.
Are you taking any medications on a daily basis?
Yes, I take Wellbutrin and I take trazodone at night to sleep.
Okay. And how are you feeling with those?
Pretty good. Yeah.
Okay.
Good.
When was the last time you had an increase in dosage on trazodone?
I started on 50 milligrams, and I've been taking it for like 7 years, and they increased it to 100 like within a month, and I've been on that dosage consistently since.
Okay. And Wellbutrin, when was the last time they increased dosage?
I actually decreased it. I was on 300 and then I got back down to 150, so
Okay.
yeah.
That's good. Have you noticed any adverse effects?
Sometimes heightened anxiety
Okay.
and agitation, and I feel like it might be due to the Wellbutrin.
Okay. And the symptoms subsided after you decreased the dosage?
They've gotten better, yeah.
Okay. Any surgeries in the last 12 months?
No.
When was your last vision check?
Like 2 years ago.
Okay. I'm going to go ahead and take your vital signs first.
Okay.
Can you please uncross your legs? Perfect. So I'm just going to first check if it's the right size. Perfect. Any hypertension in the family?
Nothing I'm aware of, no.
Okay. Okay, blood pressure is normal. Go ahead and slide this down. Okay, so 110/65. And you've been staying in this range, so that's good. I'm going to check your pulses. So I'm going to put 2 fingers right here below your wrist. heart rate is also normal, 88. Okay, I'm going to put this on your index finger. We're going to measure your oxygenation. And have you noticed any flu-like symptoms?
No.
Okay. This will go under your tongue. Can you go ahead and hold that for me with your left hand? Perfect, thank you. Okay. Oxygenation 99% under air. Okay, you can go ahead and take it out. That's good. 96.9. It's also normal. Did you have anything cold to drink before you came in?
No, I had coffee. It was warm.
Warm, okay. And is it okay if I listen to your heart? Yes. I'm going to put the stethoscope onto the shirt. Is that okay?
Yes.
Okay. I can hear only S1 and S2. No S3, no S4. I'm going to listen for any murmurs. Go ahead and take a deep breath in and then hold it for 1, 2, 3. Breathe out. Good. Let's go ahead and do that one more time. Take a deep breath in and hold it for 1, 2, 3. Breathe out. Good. No murmurs. All right. Take a deep breath in and exhale strong. Good. And one more time. In and exhale. Okay. Again, breathe in. Breathe out. Okay. And again, breathe in. Breathe out. Okay. No signs of pulmonary fibrosis or pneumonia. I'm gonna have you change in a gown and then we're gonna start the examination.
Okay.
I'm gonna go ahead and put gloves on. Okay. I'm going to palpate your face and your neck. All right, let me know if you feel any kind of pain. I'm not feeling anything swollen. Okay. So checking ahead for asymmetry. Any pain here behind your ears?
No.
Okay, so now some straight bone. It's a good sign that there is no tenderness here.
Yeah.
Okay. Checking capillary refill. Your hands are pretty warm, so that's a sign of good circulation. Okay, I'm gonna have you put your arms like this in front of you. So we're looking for that shakiness. So let's go ahead and flip them. Good. Okay. I'm not saying the shakiness. Is this what you describe as being shaky?
No, it more happens in the evening.
Okay, so it's
Yeah.
a lot worse than this.
Yeah.
All right. You can go ahead and relax. I'm just going to check some of your upper body strength now. So put your arms like this in front of you. I'm going to press down on your hands, arm. Don't let me press them down. So try to resist. That's good. Okay. All right. Decrease response on the left side. Keep them straight for me. Keep them straight. I'm going to try to push them up. Don't let me do that. Good. All right, perfect. And I'm going to try to open them. Don't let me do that. Okay. And close. Don't let me do that.
Oh.
I'm going to try to close them. All right, perfect.
Got it.
Go ahead and shrug your shoulders for me. I'm going to try to push them down. So try to resist. Shrug them again. All right, relax. Okay, so that was a little bit hard for you to do, right? It
Yeah.
seemed like, is there some tension or pain behind the neck or
I
the
feel
shoulders?
like I carry all of my tension in my shoulders. Because I'm cold all the time and just stressed. I just kind of walk around like a little old lady sometimes.
Okay.
Yeah.
I'm going to try to push your chin that way.
Okay.
I'm going to need you to resist, okay? Okay, good. Okay, and now I'll place 2 fingers on the right side of your nose, and we'll do the same thing. Try to
Try to
resist.
look this way.
Yes. Okay.
Okay.
All right.
Okay.
And on the forehead. Okay. All right. Good. Now go ahead and try to look down. Okay. And now try to look up. Okay. A little bit of decreased resistance in the temporal area. But otherwise, I would say it's a 2+, which is really good. Go ahead and look straight at my nose. I'm going to flash a light in your eyes. We're checking pupil dilation. Okay, I'm going to press down on your eyelid, looking for color. Good. And now can you please look right here? No rhythmic changes. Look here. A little bit higher. Look here now. Good. Okay, perfect. Okay. That was good. So now, as you keep your face straight, can you go ahead and follow my fingers without moving your face? So just with your eyes. Okay. can you go ahead and look at my pen light right here? I'm going to bring it close to your vision, to your nose. Okay, a little bit of deviation on the right side. All right, was that very painful? Did you feel any pain as you were doing that?
I brought it close to my nose. Yeah, a little bit.
Okay. I'm going to check your optic nerve. Okay, so we're going to start with your left eye. I'm going to have you look behind me straight at the wall. And I'm going to need you to not blink if it's possible. Okay, no deviation there. No signs of sclerosis either. Optic nerve is intact. I'm not seeing any sclerosis on this side either. Let's go ahead and switch. Have you noticed anything coming out of your ear? Any abnormal discharge or pain?
No.
Okay. So I'm just going to take a look inside your ear. Okay. Tympanic membrane is gray. No signs of infection. There's no redness. Okay, a little bit of redness on the left side. And some redness behind the tympanic membrane. It does look kind of inflamed and angry.
Okay.
That could explain some of the symptoms that you're having. It could be a vestibular reaction. I'm going to make some vibration sounds and I'll put them behind your ear. So the tuning fork, the head of the tuning fork is going to be placed right behind your ear on your masseter bone. Now, can you hear this?
Mm-hmm.
Okay. Can you tell me when the vibration stops?
No.
Okay. And can you hear this?
Mm-hmm.
Tell me when it stops.
No.
Okay. Do you still hear anything?
No.
Okay. Now tell me when it stops again.
No.
Okay.
No.
Okay. Now I'm going to ask you to tell me which position here is louder, position 1 or 2. So this is 1.
Okay.
This is 2.
2.
Okay. This is 1 and 2.
1.
Okay. Okay, now we're going to try a different frequency. I'm going to have you close your eyes. And can you please tell me with which ear you hear the sound?
The left. Right.
Okay. What about now?
Left.
Okay, what about now?
Both.
All right. So I have 2 frequencies. I'm going to have you try to identify the 256. So this is the one. Do you define this as high pitch or low pitch?
Compared to the other one, it's higher.
Okay. So try to identify the higher pitch sound and tell me with which ear you hear it.
Okay. The higher pitch is in my right ear.
Okay. One more time.
Higher pitch is in my left.
Okay. So no problems with your hearing. Okay. I'm going to ask you to close your eyes and try to take a deep breath in and breathe out. What does this smell like?
I didn't smell anything.
Okay. Let's go ahead and try that one more time. Take a deep breath in and breathe out. What does that smell like?
Cherries.
Okay. Now I'm going to place just a piece of paper on your tongue. Go ahead and try to taste this. Tell me what it tastes like.
Bitter.
I'm so sorry. Okay, so that's good. That's one. What about this one? Is it bitter again?
Really bitter.
Okay.
Even more bitter.
Which one was more bitter? The first or the second?
The second one, yeah.
All right, that is normal. Okay. What I'm going to have you do now is I'll have you lay down and we're going to examine your back and your abdomen.
Okay.
I'm going to go ahead and just slowly palpate the base of your skull. I'm looking for spine deviations. We're also checking for any bulging discs. Go ahead and tell me when you don't feel the vibration anymore.
No.
Okay. To take some measurements, we're looking for asymmetry and changes in curvatures. This is a good indication of inflammation, and if there's any kind of problems with the spine. Okay, so thoracic, it's about 11.1. All the way to lumbar, 9.8. It's 16.5. Okay. I'm going to touch you with two textures. One, it's going to feel sharp. It's kind of pointy, but definitely it's not going to penetrate the skin in any way. It's just enough pressure so that your brain perceives it as a painful stimulus. I'm going to go ahead and show you what that feels like. Did that feel sharp?
Yes.
Okay. Okay, and then I have a dull object. It's basically a brush that can elicit that dullness feeling. Okay, did that feel dull? All right. Now go ahead and tell me if you feel sharp or dull. Okay. And does this feel cold or warm? Okay, now I'm gonna introduce all three. Go ahead and tell me if it feels cold, dull, or sharp. Go ahead and tell me if you feel this on the left or right side of your spine. Okay, good. Okay, I'm gonna have you flip over on your back now. Go ahead and just slowly palpate your abdomen here. Let me know if you feel any kind of pain. I'm looking for liver size and stomach. normal sounds. Can you go ahead and tell me if this feels sharp or dull?
Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 1. 1. 2. 2. 1. 2. 2.
That's about 14. 18.9. Okay. Alright, I'm gonna have you stand up and we're talking about this results and closes. Okay, Katie. There were definitely some neurological deficits that I would like to check again. And for now, we're just going to go ahead and watch. I don't think there's any necessity to perform any invasive procedures.
Okay.
I'm going to have you come back in 1 week.
Okay.
And give me a call if you notice anything getting worse. Okay?
All right.
All right.
Thank you.
You're welcome. I'll see you soon.
All right.
Hi, Ivy.
Hi.
My name is Dr. Matt. I'm going to do your examination today.
Okay.
So, can you please verify your last name?
Yes. ASMR.
Perfect. And your date of birth?
It's June 22nd, 1992.
Okay. And you're here for some back pain?
Yeah, it's mostly in the neck though. I have it's pretty sharp pain in the back of the neck.
Is it in the middle, right, or left side?
Middle, and I feel like it radiates more to the right.
How long has that been going on?
It started maybe a couple of months ago.
Months ago? Okay. Any new stress going on in your life right now?
No.
Okay. Any surgeries to the back or neck?
Mm-mm.
Okay. Any incidents that you know might have caused this?
No.
So it just came out of the blue. Are you taking any medications?
No.
Okay. Do you have any allergies?
No.
Have you ever been hospitalized?
No.
Okay. Any new onset of headaches? Okay.
No. I do get migraines every now and then, but nothing out of the ordinary.
Okay. And for the migraines, where is the pain usually located?
I feel like mostly on the sides of the head.
Are you experiencing any tingling or any numbness in the tip of your toes or fingers?
I haven't noticed that, no.
Okay. If you look down or all the way up, do you feel any shooting pain down the spine?
It doesn't shoot down and just hurts like
stays
it's
there.
still there.
Okay, so localized. All right. Okay. I'm going to start by examining all 12 cranial nerves, and then we're going to try to see if we can do anything to manage the pain in the office today.
Okay.
I'll sanitize my hands here. Have you noticed any fevers, flu-like symptoms, body aches, any shortness of breath?
No.
Okay. So I'll put this sampling ball under your tongue. I'm going to ask you to hold it with the left hand for me, please. Let's go ahead and measure your oxygenation and your heart rate. Go ahead and relax. And I'll put this on your upper arm and take your blood pressure. Okay, go ahead and check that. 97.3 Fahrenheit. That's good. Did you have anything to drink before coming in?
No.
Okay. Okay, so it's going to feel a little bit cold. Okay, blood pressure is a little bit elevated. 135/60. Oxygenation 97%. Let's go ahead and write this down. 86 heart rate. 135/60 blood pressure. The temperature was 97.6 Fahrenheit. Okay, we'll keep an eye on the blood pressure. Sometimes what can happen is when you know that you're at the doctor's office, you automatically get a little bit more anxious and worked up. So we're going to keep an eye on it and recheck it.
Okay.
Let's go ahead and put on some gloves. And I'll begin exam. Okay. Is it okay if I listen to your heart and lungs?
Yeah.
All right. Okay. I can hear only S1 and S2. No S3, no S4. Going to check for any murmurs. Can you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. Take a deep breath in for me and exhale. And one more time, take a deep breath in and exhale. Okay, very good. Are you experiencing any ear pain?
No.
Okay. I'm going to check your reflexes. So go ahead and relax your jaw for me. A little bit more? Okay. Relax. Okay. I'm just going to raise this arm. Fully relax your arm. Okay. Go ahead and relax. Okay. Let's go ahead and check your legs as well. Okay, a little bit diminished on the right side. Okay. Alright. Go ahead and give me a big see, okay. And I'm gonna put the spatula inside this your mouth on the right and the left side. I'm gonna ask you to push it with your tongue, okay?
Okay.
Good. Okay. Go ahead and look straight at my nose. Okay. Can you cover one eye for me, please? Can you tell me how many fingers you see?
1,
Okay.
2, 1, 1, 3,
Okay. Go ahead and switch eyes.
1, 2, 1, 3, 1.
Okay. Go ahead and relax. I'm gonna ask you to put these glasses on and then cover one eye at a time, okay? Perfect. Cover your right eye. What color do you see?
Blue.
Okay. And your left, what color do you see?
Red.
Okay. Very good. You can go ahead and remove the glasses. All right. I'm going to go ahead and check your hearing now. I'm going to ask you to close your eyes and tell me when you don't hear this sound anymore.
Okay. No.
Okay.
No.
Now go ahead and tell me which position here is louder, position 1 or 2.
Okay.
And this is 1
Mm-hmm.
and 2.
Pretty much the same.
This is 1 and 2.
2.
Okay. We're just going to go ahead and do the right ear one more time. So this is 1 and 2.
2.
Okay. Now we're going to check vibrations on the upper side of your body and then we're going to move down. Can you please tell me when you don't feel the vibration anymore? Go ahead and close your eyes.
No. 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 No.
No.
Okay. It's been a very long time since we tested your olfactory nerve, so let's go ahead and check that again and see if there is anything concerning. Can you go ahead and close one ear for me? I'm going to ask you to identify what this smells like, okay?
Okay. Not really sure. It smells like some spice, maybe like garlic, onion, I don't know.
Okay.
Smells like some kind of essential oil.
Okay, now go ahead and breathe with both ears open.
Like smoke.
Okay. Let's go ahead and check your taste as well. So this is just a test paper. I'm gonna ask you to kind of taste it, put it in between your lips.
It's pretty bitter.
Bitter. Okay.
It doesn't taste like anything.
Okay.
That's really bitter too.
Okay. Was one more bitter than the other?
I think this one.
Okay.
Like salty.
Okay. There are definitely some inconsistencies there. The taste test was normal, but we did have some difficulty with the olfactory nerve. So all of that might be connected to some nerves that are shooting in the back. So I'm gonna go ahead and check your neck as well to make sure that we're not missing anything. Okay, we're gonna go ahead and do some sensory tests here on the front side, and then we're going to move to the back.
Okay.
All right. That's good. Okay. I'm gonna ask you to close your eyes and tell me if you feel cold or warm.
Cold. Warm. Warm. Cold. 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 Warm. Warm.
Okay. Now I'm going to introduce two more objects. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. And this is what dull is going to be like. So go ahead and tell me if you feel cold, warm, sharp, or dull.
Okay. Sharp. Cold. Dull. Sharp. Warm. Sharp, maybe. Dull. Sharp. Sharp. warm, cold, cold, warm or dull? Same. Dull or warm, sharp, sharp, sharp. Cold, dull maybe, dull, dull. Okay, go ahead and tell me if you feel this equally on both sides. Yeah. Yeah. Yes. 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 Okay, can you please go ahead and squeeze my fingers? Okay, go ahead and put your arms in front of you. Good. And flip them over. Okay, so we're just looking for some shakiness. Try to keep them straight as possible. Okay, that's very good. No shaking at all. Okay, I'm gonna have you lay down on your tummy and I'll take a look at your upper back and neck area. Okay. Right, is it okay if I remove the necklace? Mm-hmm. Just don't want it to get tangled. Okay. Oh. Okay. Just going to go ahead and palpate here on the right side. Looking at the skin as well to see how well it is perfused. Not feeling anything swollen, no lumps. Go ahead and lift your right leg up and put it back down. And we'll do the same thing with the left and put it back down. Okay. I'm going to take a few measurements. It's going to feel a little bit sharp. I'm looking for any information which would definitely be indicated by an asymmetry. We're checking length of the spine as well. Go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right.
I'm noticing a kind of a darker mark here in the middle. Is it painful when I touch it?
No. Left. 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 Right. 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 Left. Right. Left. Left.
Okay, go ahead and tell me if you feel this wet or dry.
Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry. 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 Wet. Wet.
I'm going to touch it with two textures. One is going to be dull. This is what dull is going to feel like. And the other one is going to be sharp. So go ahead and tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Sharp.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No.
Okay.
No.
No.
Okay. Alright, I'm gonna have you stand up and we're going to discuss the results.
Okay.
Okay, I mean, it definitely looks concerning, so we're gonna send you for radiology. We're gonna do some x-rays and maybe a CT scan as well. Are you allergic to contrast?
No.
Okay, so we might have to order some contrast too, just to take a look at what's in front of the neck and the soft tissue. It it has to be investigated a little bit in detail. And if I see anything concerning, I'll go ahead and give you a call back.
Okay.
All right.
Thank you.
You're welcome. Thanks for coming.